So, good evening, everybody, and I'm really happy to welcome you to our third EU SPR webinar, which today is really special. Um, so, our topic today is therapists and patients' views on using digital technology, including artificial intelligence, in mental health interventions. And I'd like to introduce our speaker, Vera Békés, who's an associate professor of clinical psychology and co-director of the psychodynamic program at Furkauf Graduate School of Psychology, Yeshiva University in New York. And if you're wondering what that has to do with EU, Vera reminded me of her strong Hungarian ties and roots. Vera's research focuses on the therapy process and the psychotherapeutic relationship in various settings, including online interventions, as well as using digital technology such as teletherapy and artificial intelligence for mental health interventions. So Vera, the floor is yours. We'll take about 45 or 50 minutes for the presentation and then leave about 15 minutes for questions. And if there's something really pressing, please write your question in the chat, okay? And if we have to ask Vera, we'll ask. If not, it will wait till the end and I'll read your question out loud. So Vera, thanks for being with us, and floor is yours.
Thank you so much. Thank you for the introduction and welcome everyone. I'm very excited to talk about this research, which has been part of my life for the last couple of years, starting with the teletherapy research even before the pandemic. And then with the pandemic, obviously, it was a very popular topic, so I continued. And recently I have done research on AI integration into mental health interventions and research on that. And I'm very excited to present basically the first results. So maybe it will be a little bit raw still, but here we go. So I will talk about both these areas, teletherapy and AI integration into mental health interventions. But when we are talking about digital technology and using digital technology for mental health interventions, what do we mean exactly? So I just listed the main areas where digital technology has been integrated into mental health intervention and psychotherapy. Online interventions are maybe the one that had the longest history. These are interventions that sometimes are called internet-based interventions, when there is a pre-made package of interventions that participants receive via the internet, either with or without a therapist's assistance in that. Mental health apps, I think we all know what they are about. I will not spend too much time with these. And then there is an increased number of virtual reality-based interventions, which seem to be very effective and gain popularity as well. Finally, these two areas that I will talk today about are telemental health, which is providing psychotherapy and mental health interventions via some kind of text or audio, or teletherapy via video conferencing. This may be the last one that could be the most familiar for most of us clinicians, psychotherapy researchers and psychotherapists. But there are increasingly new apps and new modes of integrating AI into mental health interventions. And these are either chat-based AI bots that address mental health concerns based in mental health apps or other platforms, or there is an increasing effort to develop avatar-based therapies. I will talk about this a little bit later, but just to take a step back and think about why it is important to research digital mental health interventions and understand where we are in this process. So we know that especially after the pandemic, the landscape has changed and many people would need to have mental health support, but they don't have access to, or there is some barrier to receive services. In the US, for example, less than half of those who would need care receive it actually. I don't have the data from Europe, but I would suspect that it could be similar. There are a lot of barriers. They include stigma, cost, access, concerns about privacy, preferences to manage the symptoms by themselves, by the patients, and also time constraints. To counteract these challenges and barriers, digital mental health interventions are able to offer services and improve accessibility, affordability, and maybe even efficiency of delivering services. However, despite these advantages, these interventions received really mixed reception among clinicians. If you are all, most of us are psychotherapists or provide care, and maybe you talk with other colleagues. My experience is that it's really mixed. There is fascination and there is a strong fear about using the digital technologies for mental health interventions for various reasons. However, it is really important to understand that clinicians and therapists who are experts on the field, how they relate to these interventions, how they can contribute maybe to the development or maybe to gatekeeping in this area. So that's why it's really important to understand how clinicians view these developments so that instead of just being dragged with the current initiatives of using more and more digital technology for mental health services, to be able to remain kind of maintain our agency and contribute to the field and say if something is not ready to be launched or there are areas that we have major concerns of. So to have a word in this development, which seems to be happening with or without us clinicians. So I'm really interested to understand how clinicians view using digital technology. And for assessing these, I use this framework, which is called UTAUT. I don't know if you are familiar with this. This is a huge model that was developed by Venkatesh in 2003, and since then has been used to assess attitudes and accessibility of digital technologies of all kinds. It has been applied in various fields, and my work with colleagues was to adapt it to assess digital mental health interventions acceptance. So the model, just briefly, is the following. The main idea is that the use behavior, that is, whether actually clinicians or patients or users will engage in using digital technology will be at the end of this model. So that will be predicted by the model. And there are various factors that will predict whether someone will engage with these technologies or not. You can see these different dimensions that were established by the original UTAUT model and then adopted for teletherapy and later for integrating AI into mental health interventions. And you can see these different aspects. The first is therapy quality expectancy. So how much the person expects that the therapy received will be comparable to traditional in-person therapy, ease of use, kind of it's I think self-explanative. Social influence, how much influence is perceived as coming from others to use that certain technology. For example, for teletherapy, do you feel that your colleagues pressure you or suggest that you would use teletherapy instead of in-person therapy? For convenience, this is a major factor. Using digital technology a lot of times makes the therapy much more convenient and easy to deliver and to have access to that. Human connection is an important therapy-specific factor. This is a major concern with any kind of digital technology used in therapy. How much the person perceives that using that digital technology will still maintain the human connection characteristic to a therapy relationship. Perceived privacy risk is really important, both with teletherapy and AI-based therapies. how much leaking of information or misuse of information can be perceived with the digital technology. And finally, hedonic motivation is really about how much the actual platform is enjoyable to use. Maybe an AI therapist we will see later could be fun to use. It's interesting. It's much more kind of appealing, just the activity than a traditional therapy. So this is the model that we used. And today I will talk about these distinct types of mental health interventions using digital technology, because these are the most prevalent, and I feel that these are the ones that really affect our daily work as therapists. So I will start with teletherapy, which is a human therapist delivering traditional psychotherapy via video conferencing, and I will talk about these two other forms of therapy. So let's see what therapy thinks about teletherapy. How much do we accept teletherapy as part of our practice? So to provide the historical context, pre-pandemic, teletherapy was not something that we would have used. However, it has been used mainly by the phone since the 50s. And pre-pandemic, it really didn't take up. Therapists were really resistant to use it, and it was not something mainstream in our practice. Patients at the same time had much more positive views towards teletherapy because they saw the many advantages that teletherapy has to offer. Access obviously is much easier in teletherapy. I don't know how you are, but since the pandemic and since teletherapy became a much more common practice, in my own practice, older adults are much more represented than before. Previously, they couldn't have come to the office simply. And now it's so easy just to connect via teletherapy. Much more flexible, of course. It reduces stigma. You don't have to go anywhere to receive psychotherapy. It's really timely access to care. Many times it's a shorter wait list for teletherapy than for in-person therapy. It reduces the cost, the travel, the childcare costs, the time that you need to take out of work instead of 3 hours assigned for the in-person therapy session with travel and everything. It can be integrated in between meetings. And there is a much better possibility to connect with a specialist who might live far away. As I mentioned, despite of these advantages, therapies still were very resistant, especially before the pandemic. There were two major concerns regarding teletherapy. The first was its efficacy. Therapists were really concerned that teletherapy is not able to deliver the same quality of therapy than in-person therapy, and it might be inferior to in-person therapy. The second major concern was regarding the therapeutic relationship. Therapists often doubt that there would be a possibility to form a really strong therapeutic alliance remotely, and they felt that teletherapy is more impersonal and maybe it's harder to convey empathy and nonverbal signs over teletherapy. In addition, they were also afraid of having technical issues, confidentiality issues, using the internet, using Zoom, and so on. Today, this has changed really, obviously. And basically, but I will talk about today. So we are still before the pandemic. There was increasing research on the similar efficacy of teletherapy compared to in-person therapy. There was increasing research on the comparable working alliance quality of teletherapy compared to in-person therapy. And overall, it seemed to be that teletherapy is just as effective and acceptable by clients and therapists than in-person therapy already kind of before. These were researches before the pandemic. And then the pandemic hit, and I'm sure you all remember how we, from one day to the other, went to provide online therapy. Of course, this was different across countries, and I was in Canada, so North America. It was very different, I'm aware of, but in Europe, many places also experienced this kind of one day to the other shutdown and going into teletherapy. And you can see the chart here shows all kinds of health interventions shift to telemental health, and the highest blue line represents mental health interventions. And as you can see, it really went up during the pandemic, the shift to teletherapy, and then whereas other interventions usually decreased in frequency to use remote formats, teletherapy stayed pretty high. And still, in many areas and psychotherapy, many people use teletherapy as a default mode of providing therapy. Most therapists are also very comfortable by today to use teletherapy. It's part of their practice, at least. There is a recent study that showed that 93% of therapists routinely used teletherapy for their practice. And by today, we really have a lot of research about teletherapy and the main concerns regarding teletherapy. So as you remember, the first concern was whether its efficacy is comparable to in-person therapy. And I just listed these big studies and RCTs and meta-analyses that show that there is a similar outcome and efficacy in teletherapy compared to in-person therapy. Regarding the therapeutic relationship, which was the major other concern in teletherapy, and I sense there is some research showing that therapists are still concerned about the therapeutic relationship. There is something different in the sense of how we are together with patients in teletherapy compared to in person. However, when we are looking at these robust outcomes regarding therapeutic alliance, it seems that it's really comparable in teletherapy and in-person therapy. So we know that teletherapy is comparable to in-person therapy. How did this affect therapists' attitudes towards teletherapy? How did the pandemic affect therapists' attitudes towards teletherapy? So the moment when this global en masse transition to teletherapy happened, there were a lot of studies launched to kind of conduct this natural experiment and look at what's going on. How is the first experience with teletherapy for therapists? Previously, there was a lot of work, including my work, invested in kind of promoting teletherapy and convincing people that this is like, there are so many advantages that we have to figure out how to do this on a large scale. And then it was kind of really miraculous how like institutions and a mass of professionals really just switched from one day to the other to provide teletherapy. And the experiences were really mixed, really mixed. We used the UTAUT framework that I previously showed you, remember this. So this same framework to assess therapists' attitudes towards teletherapy after the transition to teletherapy and then in longitudinal studies later on. So what we found was that overall, the therapist experience was unexpectedly positive. So this came back from time to time. Oh, I'm so surprised that it actually works. So it was really positive once they tried it. It was much better than they expected. And interestingly, the more therapists used teletherapy, their experiences became more and more positive. So it seems that they just adjusted. They used maybe different skills, different techniques, using the environment of the patient, including that in the therapy. So they really adapted to the teletherapy challenges, and they used the advantages and kind of counteracted the challenges with teletherapy. So we also looked at what predicted therapist attitudes, because as I mentioned, there were still big differences, and today there are big differences. I know people who love teletherapy and say, oh my gosh, this is so convenient, I will just do this, this is working super fine. And others say, I just cannot do it. It's just so different. The field is so different. I am not able to do in-person teletherapy, only in person. So we found a couple of predictors of therapist attitudes. Clinical experience was one of a major things, which was a surprise because we thought that young people would like teletherapy better. No, it seems that what really matters is the clinical experience. So if you are more experienced with working with patients in person, then you might be more confident just to tweak your skills and the therapy situation and do teletherapy with the patient. So it seems that clinical experience is positively related to attitudes and perception of teletherapy. Professional self-doubt was a major other predictor, which means that professionals who were more confident about their skills to help other people, that they were more confident that what actually they are doing is helpful, perceived teletherapy as more positive. They were also, it seems to me, my understanding of this, that those therapists who are more experienced, who more trust in their own abilities, were maybe able to adapt more easily to teletherapy. Whereas therapists who were just starting out, who were doubting themselves, they really couldn't take this big challenge. They didn't like the sudden shift to teletherapy. Everything changes suddenly when I'm not even confident in teletherapy, and now I have to adjust my skills to teletherapy. But however, the strongest overall predictor was really how professionals saw the therapeutic relationship in teletherapy. So if a professional, a clinician saw that actually they are able to build a good, strong therapeutic relationship online, their attitudes towards teletherapy were much more positive, and they wanted to use teletherapy in the future as well. So you remember that in this model that I saw, all these aspects that we are talking about, they predict first behavioral intention, and that will predict user behavior. So all these, for example, here the human connection. So if you see that the therapeutic relationship is strong, that will predict behavioral intention. Yes, I want to use teletherapy in the future, which will actually predict that I will use therapy in the future. Where was I? Okay. So these findings were similar across countries, across therapeutic orientations, CBT, psychoanalysts. There was no difference based on any of these. Now, this is great. So we know that teletherapy is much more accepted now than it was before. However, using teletherapy for various purposes, so not only for therapy, but for example, prevention, as a treatment addition, so from time to time meeting patients online, or aftercare. So there are huge differences in the acceptability of using teletherapy for various purposes. And I think this is really important, that there is a global acceptance, for example, now of teletherapy, but there are huge differences in different aspects. So you can see that it's least accepted to use for treatment, so sole teletherapy treatment, and much more accepted for as an addition to treatment or doing aftercare in terms of psychological treatment. So how can we apply all this knowledge to acceptance for using AI for mental health interventions? Just to take a step back and look at where we are with technology development, there are many chatbots, probably you know these, that are offering mental health support for people, and they have 24/7 access. It's really convenient. It provides a lot of privacy. People can use it wherever they want to. If they cannot sleep, they can just pull out the little pocket therapist, and it really is very convenient. It seems, based on the the preliminary findings, that they are effective in reducing depression, anxiety, and stress symptoms. And surprisingly, in terms of therapeutic alliance, it seems that the ratings given to these chatbots are similar to ratings that we would obtain for in-person psychotherapy with a real human therapy. So it seems that people do develop therapeutic relationship with these chatbots. Now, the other application of AI for psychotherapy and mental health intervention is something that we might not be that familiar with, because it's really kind of under development at the moment, but it is really rapidly coming. It is coming. There are two applications so far that are used with patients that I know about. Maybe there are more, but this is what I know for now. So these avatar-based therapies use AI to imitate a human therapist who behaves and responds just the way as a human therapist would theoretically. So this is the goal. So these two apps that are out there, the first that you see, it's called Ellie. It's a virtual therapist. You can watch videos of how it works on YouTube. And the second one is an avatar-based therapy, which is really like a genius idea. They use it for people with schizophrenia to embody the hallucinations that they are having, and they can have an interactive conversation with this kind of persecutory hallucination. So you can read up on that. I think these are fascinating initiatives. So, but in the meantime, there are several startups that are working very actively on developing um, human-like AI therapists, and and I think it's very, very soon they will be available for use. Yeah. Okay, so there are the clinician attitudes and acceptability of these is very mixed, right? So usually patients are much more positive towards using technology for therapy. In the past, this is what we found with teletherapy, and this is with what we found with integrating AI into mental health applications as well. Patients are more positive, but I will talk about that a little bit later. And we saw that the pandemic improved the clinicians' perceptions of teletherapy, but skepticism is really, really strong towards AI tools, really strong. There are major concerns that were noted already in the literature regarding AI tools, and that's the lack of personalization and emotional depth. A major issue is confidentiality, data security, and ethical concerns. And it seems that chatbots are much more acceptable for clinicians when they are used to kind of just support mild or moderate problems and issues, and are not used as a substitute for a real therapy. I'm just looking at the time. Okay. So let's see, I'm just jumping over slides. I was too overly ambitious and very excited to talk about this new research, but I will just focus on the main aspects. So to understand what therapists are thinking about these digital mental health interventions, we wanted to first see how therapists accept different kinds of digital mental health interventions, teletherapy, AI virtual therapist, and AI chatbot interventions. So we had a therapy sample of more than 600 therapists. We used the prolific platform to recruit participants, and we screened them. So finally, we had clinicians, which included mental health professionals, therapists, and counselors. And we really made sure that these participants had experience directly working with clients. So it's not just theoretical or some kind of certificate, but they actually worked with clients. So they had an insight about how it is to work with somebody. And we really wanted to know what they were thinking about AI integration. So you can see the demographics here. It's a pretty typical age, 44 years old on average, a little bit more women than men, and they had 5.6 years of clinical experience on average. Okay. So, and I already show you the first result. So this is a comparison of therapist AI attitudes towards the three kinds of digital mental health interventions. So it's this is a bit small, but you can see that this first column denotes teletherapy. The second is for chatbot, and the third red one is for AI therapist avatar. So when we look at, let's start from the end, so this is the overall score, we can see that the acceptance of teletherapy is much higher than the acceptance of chatbot or AI avatar therapies. Probably it's not really surprising for any of us. But the interesting part is what drives these differences between acceptance of different forms of digital mental health interventions. And all the other columns show these different aspects of the differences based on the UTALT model. So again, just a reminder, maybe it's too much, but just so these are the predictors of user behaviors. So we assessed those, and these columns show each of these aspects of the UTALT. So therapy quality, ease of use, social influence, convenience, and so on. So all these differences between the different kinds of therapies were significant. And you can see that teletherapy is high above each of the other forms. However, there are big differences between chatbot and AI avatar interventions as well. So, for example, for quality, therapy quality, therapists expect higher therapy quality with an AI avatar than a chatbot. Ease of use is similar, but still easier for a real avatar therapist. And social influence is much higher to use chatbots, right? Like the acceptability of chatbots is much higher. It's much common to use it. The convenience is similar between chatbot and avatar. And the human connection, interestingly, it's also very similar, but it's lower for AI avatar. So the human connection would be something like the relationship between client and therapist is similar to an in-person relationship between client and therapist. So these kind of statements were included in this aspect. The perceived privacy risk is similar. Hedonic motivation is a bit higher for AI therapists, so it's much more fun I can imagine, it's much more fun to try it and work with an AI therapist. And finally, the behavior intention is the most important, basically, if you remember. So all other aspects predict behavior intention, which will predict whether actually people use it. And it seems that the behavior intention is higher for an AI avatar than a chatbot. So it seems it's probable that people will use it even more than they use chatbots. Now, this was the first research question. The second was what predicts the acceptance, whether we can identify factors in therapies that would tell us why they are more prone to accept these digital interventions than others. So, and these were the three categories of predictors that we looked at. We looked at age, gender, resident locality of residence, clinical experience, licensure, treatment manual use, thinking that most of these chatbot treatments, for example, are based on CBT and they are so task-oriented that maybe that would lend itself to more acceptance. We looked at therapeutic orientation, primary patient population, whether clinicians treated adults, primary, or kids and adolescents, and whether they had past teletherapy experience, thinking that maybe if they do teletherapy, they are more open to use AI as well. And for technological aspects, we wanted to see whether technology use, meaning how much smart technology you use every day with at home, like apps and all kinds of household AI-based tools. We measure general attitudes towards using AI. And we also measured whether they used AI mental health chatbots in the past. So what we found was, and this is a long table, but this is for the AI chatbot acceptance prediction. So we saw that when we looked at these predictors separately, so here are in the first row, you see the demographic predictors. In the second one, the professional predictors. The third is technological predictors. And most of them were significant in the demographic predictors. So we see that higher age was related to more acceptance and male gender identification was related also to higher acceptance of digital technologies. From professional predictors, however, it was much more blurry what predicted. There was a small significant effect for using treatment manual. So those people who use treatment manual, it's negative, but it was phrased that it means that those people who use treatment manual were more prone to accept digital mental health interventions, but the other predictors were not really significant, except from patient population close to, well, significant, but not very strong. Those who were using, whose primary population was adults, were more positive about using digital technology. And finally, from technological predictors, general attitudes towards AI was really strong. Like that was maybe the strongest predictor. AI use at home didn't predict anything, and experience with chatbots was related positively to use of technology. But overall, the general attitudes towards AI was the most important predictor. And then we just look at quickly at the same thing for virtual therapies. It was really similar, except that there was a small difference in urban, rural area participants, in that people living in more urban areas had more positive attitudes towards using digital technology. And the treatment manual effect remained, patient population effect remained, and past teletherapy experience really related to more acceptance of using AI virtual therapists. And for technological predictors, it was the same. It didn't matter how much AI you use at home, but the past chatbot experience and the general attitudes towards AI were important predictors. Okay. So overall, this is just a summary table. When we put together all the significant predictors from the previous model into one large model to see what is the most important after all, what we found was that for AI chatbot acceptance, the demographic variables disappeared. They were not significant anymore, neither the professional variables. However, the technological variables were the most important. General attitudes towards AI. Do you think that AI is great for humanity? It will bring joy and happiness and, an easier life for us, or it ruins us forever? Really, this was the basic predictor of using AI for these digital technology, for these digital mental health interventions, and the overall model explained 34% of variance. Similar for the AI therapist acceptance, demographic variables, the demographic wasn't important, became non-significant. From the professional variables, only working with adults remained significant, which kind of makes sense, that we want to protect the youth and the children. We read all these horrible news about youngsters listening to AI-based suggestions and how tragic outcomes there are sometimes. And technological variables is the same. The general AI attitudes and AI chatbot experience predicted overall 38% of variance. So I will be very quick. I really want to show you a couple of other results, but I will just jump from slide to slide, and I'm apologizing if I don't introduce them sufficiently enough, but I hope that at the end, if you don't understand something, you will just let me know, or you can jump in if it's really confusing and you're not even sure where we are or what I'm talking about. So there are a lot of concerns about AI technology, and these are quantitative findings. So we know now what predicts more or less the acceptance, and we know what are the aspects that are different across these, but we don't know about major concerns. And we know that there are major concerns which are based on ethical concerns and ethical issues. So that's why we conducted a small qualitative study to ask therapists about their concerns, like why they are hesitant to use AI. Do they have ethical concerns specifically about using AI? And this was the actual question that we asked: are you concerned about the ethical implications using AI for mental health interventions? And we saw that from these therapies, so this is the same sample still, so about these 600 plus therapists, about 300 said that they do have more than 300, so more than half said that they have concerns ethically about the use of AI, and they provided us some qualitative responses of what their concerns were. So we conducted a thematic analysis on this data, and I will show you just the major concerns that the therapist listed. So the highest ranking concern was regarding data privacy and confidentiality risks, then lack of emotional understanding and empathy for the side of an AI tool, misinterpretation, bias, misdiagnosis. These were the top three concerns. And let me just show you a very busy table. You don't need to read everything, but maybe these are really illustrative quotes by therapists illustrating each of these aspects that I just showed you previously. So on the left, in this first column, you see the concerns that were listed previously. The definition is, I think it's kind of pretty much clear. And then the therapist quotes are in the last column. So I just give 1 sec to skim it through. So I think the reason why I'm not even prone to go through each of these statements is that when I found these, I thought that, oh yeah, of course, like everybody knows that, everybody thinks that, right? Like this is something that we are talking about with colleagues. I was surprised not to be surprised. I thought that therapists would bring up like new interesting aspects, but they didn't bring up in this first batch. So it seems that the top ethical concerns are really these kind of basic ethical principles that are professional, related to professional values, and that are really kind of consensual among therapists, that these are really major concerns. Which I think in itself is an interesting and really important result, that there is no kind of contradiction or disagreement regarding these issues. Like these are the major things that therapists across the board are thinking about. And then when we analyzed the smaller topics, we found more. Like we found so like interesting stuff, and they described like new aspects that maybe we didn't think about. And therapists gave us very interesting kind of scenarios what can go wrong. And you can see this list of things that can go wrong according to therapists. And they gave us really great examples. I can't wait to write it up. So, but here you see the therapist quotes. I also just leave a couple of minutes to read it. So overall, it seems that there are these core issues that are fundamental and that therapists agree about the dangers of using AI for mental health interventions. And they really tap into these core professional values such as client safety, trust, connection, empathy, confidentiality. And then there are these secondary risks that were mentioned by much less therapists. Actually, there is a gap between these very common issues and the second one. So just for showing it, because it's so interesting, you can see that these core issues are mentioned by at least 60-70% of therapists. And then the second batch, all below 10%. So these seem to be really kind of more individual concerns, or like concerns that people are preoccupied, but it's not consensus across the whole profession. But these are also really important, and maybe these might be more depending on the therapist's theoretical orientation or the population they are working with, or with their personal experiences, either with tech or with mental health services. And I'm just looking at the time. Okay, I think I will stop here, maybe. I will go through the summary and conclusions, and then there will be time for questions. Okay, so just to summarize all this, so AI-based interventions are much less accepted than teletherapy across all aspects. However, there are a couple of aspects that are more accepted in avatar therapy compared to chatbot therapy. The relationship to technology is the most powerful predictor of acceptance and working with adults for AI therapists. And well, this is what I didn't mention. The acceptance depends on the stage of application. I'm happy to show the slide about that later on. And the moral concerns are really important, but there is a relative consensus on what are the major issues. And in terms of going forward and what could be the conclusions based on these, um, so it's really the first aspect is setting priorities. So it seems that there is a broad professional agreement on core ethical concerns. So it's really important to focus on those to develop ethical AI use and addressing these aspects. It's really important to think about integration as opposed to replacement. This comes up in the ethical concerns and also in the slide that I didn't show, and now I regret because it would make much more sense. But when we are thinking of integrating AI, we can be more nuanced in thinking it through which areas of AI use could be really beneficial. We could use it for supervision, we can use it for taking notes, we can use it for schedule appointments with patients, we can use it to support clinical decisions. And these are really helpful areas where AI could be enhancing psychotherapy led by humans. But when we are thinking about integrating AI into the mental health interventions, I think it's a very scary idea. Not I think we found it in the results that it's a very scary idea to think about autonomous AI without a human oversight. Right? That a machine would make clinical decisions and there would be consequences which are questionable ethically and professionally. Another important aspect is regarding developing culturally competent AIs. We all know how the training data can be very biased. So it's really important to avoid just providing one AI model for across various diverse populations instead of adjusting it to the given context. And it's really important, finally, to have professional legal control over the commercial use of AI and the defining responsibilities, defining limits of data use, and really have very, very strong regulation. So thank you so much for your attention. And of course, I have wonderful collaborators and students that I work with and some grant support, which I'm really grateful for. So I can answer questions. Now maybe we can have a discussion.
Yeah. So maybe we can take down the PowerPoint so we see everybody. And I think it's best if you use the hand raising, and then we'll see who wants to talk. And I'm just reminding everyone that this will be uploaded to the SPR website or YouTube channel, Galit, where
The YouTube
will
channel.
be,
Yeah.
so it will be it will be possible to view this and kind of follow. Okay, so questions, comments, just put a hand raise. Okay, Oliveira, what's your first name? Sorry.
Hello, it's João. It's J
Oh,
for
wow, right.
John
Yeah,
in Portuguese.
yeah.
Thank you for the opportunity and thank you for the presentation. I would like to give you maybe a chance, instead of answering a question to go over those integrations with AI. I heard, and I've tried a few applications regarding notes,
Mhm.
and it would be interesting for me to explore that with you a little bit.
Okay. You want to respond question by question or take like 2, 3 questions and then respond? What's works best for you?
We can collect questions and then maybe respond.
Okay. So someone else had their hands raised, I saw a minute ago. Okay, I don't think I'm seeing the full
Okay.
screen.
Maybe if there are no other questions, I can start answering this and maybe
Okay,
other questions
good.
will
Okay.
come up. So,
Mhm.
so I'm wondering, so regarding AI integration, I'm not sure that I understand exactly your question. Would you like to can you just reiterate what you meant?
I meant especially the notes, when you use notes for
Ah,
summarizing sessions or to listen into the sessions, and then sort of like applications for meetings. I'm sure you're familiar with those, and I think there might be the same concerns regarding privacy or misuse, or AI missing something, or any kind of technical issue that could happen. I'm curious what you already know about those integrations. So when I mean integration, I mean using the technology to enhance the therapist's work. So it would be the sort of like probably applications of AI in other areas. It's not going to directly replace a lot of jobs, but it would actually force, in a way, the current population that is working in the field to do something different, right? And so that's what I was looking ahead into.
yeah. Thank you so much. Now I understand much better. So this also gives me an opportunity to show these slides that I skipped because it's really important for answering this question. So when we are talking about AI integration, we can really think of different stages of AI integration. And there was this wonderful paper that just came out about the different stages, and it's really it's nicely makes this comparison to self-driving cars. Like the different stages of how AI can be integrated into a process. And based on this, we can talk about 3 levels of integration. The first is the assistive AI, which is really the note-taking, the summarizing, the appointment-making AI. So it really just helps the therapist as an automatic assistant. I think that many of us are already using some of these tools. The second stage would be the collaborative AI, meaning that the AI has much more responsibility, but still there is a human oversight. So there is this human in the loop level still, that, for example, the AI could suggest various therapy approaches to a certain patient problem, or the AI can suggest, for example, assessment tools for specific patients, but there is a therapist who decides whether or not to use that. So it takes it as an advice, as as an informed input that could be helpful, but still within the therapist overview. And tools, for example, that are already used, for example, for supervision and training, could be included in this category. There is an oversight of a human therapist, and these are tools that are helping us. Now, the third stage is the fully autonomous AI, which is the scary part when there is no human in the loop, but it's really up to the AI to deliver psychotherapy, mental health interventions, assessment, and so on. So this is really important, I think, to separate these. And in our study, we looked at the acceptance of these by therapists. So this is what we found. You can see that the first 3 are all assistive AI, but we broke it down to different aspects, what we found, because we are already using assistive AI. So the first one is AI for research. So for example, analyzing psychotherapy videos for research by an AI. The second is for clinical admin, these examples that I mentioned, note-taking, appointment, and so on. And the third one is for clinical therapy. So for example, you would ask the AI, this patient has this specific problem, what are my options? And then it just, like ChatGPT, you can ask like, what would you do in this situation? So kind of gives you just suggestions. And you can see that these are relatively higher accepted. And I included the Likert scale here to see what it means. So it starts with one very uncomfortable, right? Like one is very uncomfortable and five is very comfortable. So the 3.5, 3.6 means that people are neutral or somewhat comfortable with these usage. And then we see that for the autonomous AI, it really goes down, right? So the last stage, therapists are really not comfortable, which would be like somewhere 2.3, let's say, so somewhat uncomfortable and neutral, but below neutral. So there is a much more, and you can see that the standard deviation is really huge. So some people find it absolutely uncomfortable.
Okay, I see there are a couple more questions, so we'll take a few more minutes. Vera, Patrick, you were first, and then Hannah, and then Kim. Okay. So Patrick,
Here.
you're muted.
Now
Yeah,
I'm okay now? Okay.
yeah, you're fine now.
Thank you, Vera, for a very your interesting and very extensive overview of this rapidly developing field. And give my regards to Katie from Norway. She knows a little bit about our work here, but we're just starting to do some work with AI in a private company, and we are in stage 2, I guess, where we give daily mood checks, and the AI gives suggestions about meeting other people and not taking not having don't be having catastrophic thinking, and some basic types of advice. And we check that professionally, but there's still a pressure, I think, isn't it, to go to the commercial interests are trying to push to get us out of the loop. And I wonder if you have any ideas about how we can avoid that and keep the legal and the professional control, ethical control.
Yeah, I have been thinking about this a lot. And what I see when I talk to colleagues that almost all of us working in research and AI were approached already by startups. Everybody is developing these tools.
Right.
Like it's so common, so common. And it's a dilemma, and people respond differently because some say, no, I really don't want AI to develop so quickly, so I will just hold back. I will not help these companies. But others are saying they are developing it with or without us. So I'm inclined to, think that we have to be on the top of this,
Yes.
and in an informed way hold back aspects and help and guide because it is happening. So I think that this kind of research is when we really explore what the concerns are, what are the professional opinions, apart from maybe personal feelings of, lack of agency, we are losing our jobs, and, like the whole kind of where the whole world is going, and this kind of catastrophic, as you mentioned, scenarios. So really looking at like being professional and looking at, okay, so what are the concerns? What is happening and how can we represent the professional stance and ethical values, and how can we really guide the development of these tools.
Okay, thank you very much. You gave me some
Hannah, and
good
then
ideas to what we can work on. Thank you.
Hannah, and then
Yes.
Kim.
Thank you so much. I'm
Hi.
sorry for my absence of visual here, but I've been listening very intently. Thank you so much, Vera. I'm interested in AI with regard to supervision, but I'm noticing with the data that you presented that there's a disparity between some of the professional concerns and the research findings. So again, we have this clinical research gap. I noticed for example, with empathy, it's been shown that autonomous AI gets very high ratings in empathy. And in fact, in blind studies, patients prefer the empathy that they get from AI.
Mhm.
And yet, this is one of the professional concerns. In the list of predictors, I didn't see awareness of research as a predictor. Am I understanding that correctly?
Yes, you are very right. It was not part of the Utah model, and we didn't include it as a variable. But it's a very good point that the information, like it's really blurred what are personal kind of fears and concerns and what are based on research. I absolutely
Right.
agree, and that should be research in the future. Yes, absolutely.
Thank
And we know like many areas, and the major concern about the connection and the lack of relationship with the AI, that seems that I don't think that will be an issue. People do develop relationships and connections with everything, like like we have so many movies, but also research showing that people develop relationships with chatbots. For sure, there is a good working alliance, and we are just wired to develop relationships, and I'm sure that people will do that, and that's more dangerous, that people will develop the relationship, than the danger that they will not develop relationships.
Thank you.
Yeah, Hannah, I was thinking of deliberate practice, that AI could be helpful in just practicing and skill building and stuff
It's
like that.
already there.
It's already there, so I
Already
should
there.
move along. Okay, Kim, you're raising your hand.
Yes. So I'm actually sort of following on that because we are starting to use AI indeed in skill building environment. We just started a pilot in our university where we use AI for students to practice in suicide prevention skills. So the chatbot creates a client, and there's a feedback bot that then gives feedback based on what we give as input and what kind of markers need to be in the response. I do see a lot of potential for AI to be assisting in training and providing feedback to therapists in terms of how they can improve themselves. But I'm also wondering, do you think that the ethics of that are similar to the ethics that are a concern, obviously, in working with patients? It's a different dynamic, I think, because it's basically giving feedback to the therapist, but it's still using personal information. But I can imagine that the balance is a bit different in that area compared to working with patients. And I was just wondering what your opinion on that is.
Yeah, that's a good question. So that would be kind of a supervision situation, and training and supervision, as opposed to therapy enhancement directly.
Yes.
So for training and supervision, what are the ethical requirements and concerns? That's a great question. I am not sure. I am not sure how it is, how this, like, general, I don't know, I would just start thinking about like general professional ethical concerns about supervision and how it can be controlled. Like, who is the liability? I would think that that's a big question. So if the AI supervisor gives like a wrong suggestion or something that will eventually lead to harmful interventions, then who is responsible? These are so intricate questions, and yeah, there's no legislation about that.
No, I agree, and it's complicated, I think, in that sense that on the one hand it offers a lot of opportunities, and on the other hand, there's also so many ethical concerns, and the technology is moving so much faster than we can sort of figure out the ethics in some way. So yeah, I just
Yeah.
think it's interesting to think about.
Yeah, absolutely. And it reminds me of when we switched to teletherapy during the pandemic, that the legislation was also like something that crumbled the sudden change, and then it caught up quickly. So I'm wondering whether this will be the case again, that things are just happening and then, we have to follow. But ideally, that would be wonderful if we could work more on creating legislation first.
We
Yeah.
have time for one more question. Licia, did you want to ask your question? Because it looked like an interesting one. Would that be okay?
Okay, I try. I thank you for the good presentation, very clear. From a dynamic point of view, I was wondering if the use of AI can work as a therapeutic aid in the same way as in the same way as lateral transferences from a dynamic point of view to promote projection and knowledge of the mental representation of a relationship in the patient.
So just so I are you asking if there could be a transference to the AI that would then tell us something about the client?
When the patient use AI to communicate, he makes a
Right. Yes.
transactions, and so as lateral transferences for me.
Okay. What do you think, Vera?
I'm asking if that can.
Yes, Vera, what do you think?
Study
Yeah,
the dynamic functions of AI, the use of AI.
yeah, absolutely. I think it's a wonderful platform for transference. I don't know if you heard that. It really haunts me, that news about the character.ai, when a young boy kind of fall in love with an AI character and committed suicide, and it's a really tragic story. But it really is about transference to. I do think that it will develop probably even stronger than with a human person, especially if there are no controls regarding to that. So if the AI feeds into that transference as it happened, it seems in that case, and there is no kind of control over addressing the transference and using it to feed back to therapy for as a material to analyze and understand.
And to intervene also. And
Yes.
then to intervene by interpretation or other ways. Thank you.
Hey, wow. First of all, Vera, thank you so much. I think this is raising so many questions. I think some people asked, and it's totally up to you if you would be willing to share the slides or not. But if you are, can you put your email on the chat for a second? And then whoever is interested can copy that.
Yeah.
Okay. Thank you very much. And thank you all for participating. And thank you for wonderful assistance, Galit and Juan. Thank you. And good night, everyone.